Hi, I'm Lauren Massey, physical therapist and board-certified orthopedic clinical specialist. I'm also the owner and clinical services director of Bay Area Physical Therapy and Lafayette Physical Therapy. Today we're going to talk about caring for a rotator cuff injury with physical therapy. So, to get all of us on the same page, a little bit about anatomy. What is the rotator cuff? The rotator cuff is a group of 4 muscles, generally speaking coming off of the back side and underside of your shoulder blade and wrapping around to the outside of your arm bone or your humerus. It does help primarily with lifting the arm out to the side and of course rotation, as the name suggests. How does the rotator cuff become injured? It can be overuse, wear and tear over time, or it can be with trauma or overuse in a sport. So sometimes we'll see rotator cuff injuries in overhead athletes who are doing a lot of throwing motions and decelerating of the arm. But I also see a lot of wear and tear injuries of the rotator cuff in our geriatric population or our overhead workers who are constantly lifting and doing things up with their arms above the head. One thing that we want to make sure is that we're actually treating the right thing. So when it comes to rotator cuff injuries, a lot of times I have people instantly walking in the door with shoulder pain and the first thing they assume that they have injured is their rotator cuff. But there's so many other structures in the shoulder that can be affected that it isn't always a death sentence that you have a rotator cuff injury and you're going to need to have surgery. So we have the special tests that we can do on evaluation day to test your strength in different ranges of motions and poking and prodding to see how close that can get us to a diagnosis. But we also have the availability of musculoskeletal ultrasound, which allows me to see images of many of the structures of the shoulder, including the rotator cuff tendons, to see if I do see any tearing, tendinitis, tendinosis, all of those typical tendon injuries that we can treat here in physical therapy. Again, a lot of times I'm talking people off the ledge that because they hear that they have a rotator cuff injury, they assume that means they have to have surgery. Not everyone who has a rotator cuff injury must be rushed into surgery, and honestly shouldn't be rushed into surgery. We want to make sure that we always exhaust our conservative care approaches first and consider the activities and exercises and hobbies that you might have to see the demand that's going to be put on those tissues in the future to know if you really should be a surgical candidate or not. So how does physical therapy help with this? Again, we're going to do all that testing to make sure we get to the root cause of what we're treating, and then we're going to make sure that we stretch and strengthen the areas around the injury to help decrease stress on the tendon or tendons involved. Again, as I mentioned, there's 4 tendons in the rotator cuff and there's some overlap in the jobs that they do, and there's other muscles in the shoulder that can help elevate the arm. So once we determine whether you need specific surgical intervention or specific treatments from a physician, we want to start with the conservative approaches of strengthening, stretching, and evaluating the biomechanics that might have gotten you there. So if you are an athlete, we're going to be looking at your throwing mechanics. If you are an overhead worker, we're going to make sure you're strong in the other areas or look at exactly what position your shoulder is in as you're doing the activities that you have to do for your occupation. If you're having a lot of pain and that's limiting you from moving your shoulder, we're going to first start by treating that pain with some of the modalities we have in office. Some things as easy as electrical stimulation are available to us, and we do have a class 4 laser that can help treat pain and inflammation to allow you to be more willing and able to participate in the rest of the physical therapy program that we have established for you. First and foremost, getting back that range of motion and then rebuilding the strength and retraining the movement mechanics that have gotten you there. If you would like more information on our class 4 laser, please see our vlog entitled How a Warm Healing Laser Can Improve Physical Therapy Results. Please check out our other 2 vlogs, Why Physical Therapy is Effective Relief for Shoulder Pain and How to Avoid Surgery with Physical Therapy. If you need help from a physical therapist today and would like to discuss how we can help you control your pain and hopefully prevent surgery, please call our front desk today for a complimentary consultation or to schedule an evaluation. Thank you.